Build a life worth living. 360 success. 360 success.
Welcome back to 360 Success Podcast. I'm your host, Dr. Ryan Knight. And today, have we got a treat for you? I mean, this guy that I'm about to introduce, he's already moved me to tears this morning just talking. But just imagine this. You grew up in a home with no indoor plumbing. You carry water every day as one of your chores just so that your family can survive. And then you fast forward to literally performing delicate brain surgery. And today's guest has lived that transformation and that journey. And I'm so pleased to have Dr. Yal Sarpong. And he is a neurosurgeon out of the Dallas area. And he has an office about 30 miles from here. He has an incredible story. You know, when you meet someone and you just immediately vibe with them, that's what you and I have had.
I felt that way too when we met. It was a pleasure. It was an honor to have met you.
I mean, It is just to be. I mean, neurosurgery. If you're not familiar with the way medicine is, it's kind of the top of the food chain.
I don't know about that.
Well, academically, it is.
It is.
It's one of the hardest residencies.
Yeah.
It is. It's impressive. But I'll tell you what's even more impressive. This guy's his whole persona, his humility, and his. You know, I'm going to cry again because we were just talking about his heart to serve. We're going to get into all that. So, you know, I'm just so glad to have you today. And this isn't just a story about success. It's a story of sacrifice, of vision, and relentless belief that your past, although it influences your future, right, it doesn't define it.
Yeah. And I want to say something that my mom told me when we first came to this country. She told me, never forget where you came from, because that will drive you to your success. And it's been an amazing journey. You know?
Never forget where you came from, because it drives you to your success.
Yeah.
And so you said when you immigrated to this country, so go ahead and tell everybody you came here. And
Sure. So I was born in Ghana in a town called Kumasi, which is one of the second kind of biggest city in Georgia, in Ghana. When I was born in 1981, at that time, my dad immigrated to the United States. So it was my mom, myself, and my two sisters growing up. It was we had our cousins that lived with us, because my mom also was helping raise some of her sister's children who were, who didn't have much. But we have something because, my dad was in the U.S., was able to bring some money to us. And at the same time, my mom was also a teacher. So that was my background. My dad was in the U.S. My mom was a teacher. That was sort of my early influence in my life in terms of kind of dedication to work, dedication to understanding what life should be and where you should go with yourself,
So your mom was educated. Your dad, assume educated, but came to the U.S. seeking a better life for his family. And you guys were, and I love that. I've kind of shared with you, I think, that I had a 4-generation home for years and, taking care of family. Yeah. And so I love that culture.
Yeah.
So growing up as a child in Ghana, you had mentioned to me earlier that your parents had built a home, but there still was no indoor plumbing. Yeah. And so what was it like, just the day-to-day chores? And I mean, your son's obviously not going to have to do that.
Of course.
Yeah.
But I wish he could, though, because that built, let me tell you a story. So, everybody in the family had something that they had to contribute to the house.
Right.
I was the younger one, and I have cousins that would help make the food, go get the groceries and stuff. Like my mom was obviously working, so my job was to provide the whole family water. So I will come in from school, go to school. So school usually started like around 7 a.m. We'll be done by.
Don't tell the kids in the U.S. that, because they're like, oh, it's 8 o'clock.
7 a.m. So they believe early bird so everything started early. So you had to actually get to school. You had to you clean up the school yourself. So so you go in, you're assigned to a team. You have to clean up your classroom. You had to clean up a session, and if you didn't do it, you get in trouble. So
that's fantastic.
So you had to be in school early, early, probably like around 6. Do your cleaning, and then be ready for class. So. I'll go to school from 7, be done by 3. I come home, and then, go. My job was to fill the whole, replenish the water supply in the family. So I'll be carrying one bucket. When my mom used to make when I'll have one bucket on my head and carrying one bucket like that, bring it in and just filling the house up. And it would take almost 2 or 3 hours to get it done.
Wow.
After that, you have to study, make sure you got your classes done, and then be ready for school the next day. So that was my life.
So grow up with that work ethic though? Like you said, you wish you could. That's one of the things I have. I have 3 boys, and I've always just tried to find things for them to do.
Yeah.
Because we have somebody that takes care of our yard and stuff.
course,
But I'll be
yeah,
like,
of course.
you got to pull weeds out of that flower bed. Just anything.
But I think one thing I will always make my son get exposed to, like going back and seeing that culture,
Yes.
seeing that sort of that lifestyle. It's like you live in a privileged life right now,
Yes.
and you have to understand and have to respect and have to make the best of it.
It's privileged because of your sacrifice and your work.
Yeah,
Yeah.
and that is the truth. That's
Yeah.
the truth. But he also understands that this country. I know we've had our issues recently, but it's a great place of opportunity.
Yes, I agree.
Great place of opportunity, and you have to see it that way, and you have to work towards that. Because if you work hard, I believe firmly, if you work hard and you do the right things always get right for you in this country.
I love that. We're going to
Yeah.
get to what it was like growing up and there in your early years, and then in the U.S. and kind of what those opportunities were and what some of the challenges were, because I know those were there. But so when you were a child, what were every kid dreams of something.
Yeah.
What was your dream?
All right. So the reason why we were able to come to the U.S. was my uncle, one of my biggest heroes, earliest heroes in my life. So a little story about him. So from my mom's side, my mom, they grew up in a small village. I'm talking about the stuff you see on TV, like didn't have enough to eat, like living in a mud hut, that type of stuff,
Okay.
And my uncle, he had the work ethic, and he was very smart. So he worked so hard that, in the 50s, he got a scholarship to come to Canada to study.
Okay.
And, he mentioned some of the difficulties in terms of it was that time when the whole concept of racism was pretty harsh in this part of the world.
Yeah, the 50s or whatever. Yeah, for sure.
So, it was difficult for him, but he realized that, this is my only chance to help my family. So he worked so hard. So by the time he finished, he got a job with the World Health Bank, and he was one of the heads of the IMF for a long time on the African continent. So he shows me one of my heroes in terms of I always say, if he can do it, there's no way I can do better than that. So there was all these sort of inspirations, all these sort of belief that you can always do better if you try,
Yeah.
So,
You're certainly an example of that. So do you remember coming to the U.S. when you were 12? Was it that's okay. I didn't do a lot of research on Ghana, but is English the native language there?
So it was colonized by the British.
Okay.
So English is one thing they spoke. However, it's a different English. It's British English versus, Deep South English.
Yeah. Right? What you're in right now. Just listen to my voice.
Yeah, I know. So, it was hard trying to understand the slang, trying to fit into the culture, understand the culture. But it's very different culturally.
Well, and even here versus Georgia, it's different.
It's very different. So it was different. I mean, it was good. It was hard assimilating to that system, but everything is a learning process, And I feel like coming at 12, it gave me the opportunity to assimilate a little bit better than if I came a little bit later in my life,
Right. Because you still had some growing up to do.
Yeah.
And so when you first came here, so that would have been, what,
93.
93 when you first came here?
Mm-hmm.
What were some of the culture shocks that you remember that, besides the accent, was different?
It was cold.
We have more winter even in Georgia.
Yeah,
right?
that's
Atlanta.
right. So we came in that November that year, and it was freezing. It was absolutely freezing.
It was 50 degrees. Yeah, you came in today. It's probably 50 today. And you have a scarf.
Yeah, I know. I thought. No, honestly, some of the things that I remember, I think one thing I picked up on is just the opportunity. Because let me just give you an example. So in Ghana, you have the have and the have-nots,
Basically,
and two very separate group, We were not the have-not, but we didn't have it. We were kind of in the middle. So I was able to see
a little bit of middle class
a little middle class there. Yeah. I was able to see someone that, I had a lot of friends I had with in the have-not. There was a lot of starving. There was a lot of, and even us, when we had food, it wasn't as much. Just the opportunity you saw, that was one of the biggest shocks to me. It's like, wow, people can have this, So it was encouraging at the same time. It made my mindset you have the opportunity. Some people that you left back home can't have this. So you got to make the best of it, no matter what. You know what I mean?
You said, I've heard it said, we're talking about kind of, I guess, cultural, or I don't know, even classes, I guess. There's a class system. But Even in this country, I've heard it said, and you can tell me, I mean, I've traveled to other countries, but I've never been to Africa. I've never been to what people consider third world countries. And I've been to like deep parts of Mexico, which is some of that's pretty rough. But, the poorest people in our country seem to be better off than what we consider poor in other countries.
I think that sort of the social cash net in this country is better compared to some of these third world countries because there's none.
Yeah, they have supplements for food and housing and things like that. We don't have people living in shacks with a piece of tin over the top, and like I've seen in Mexico or on TV and things. And we're going to get to it in just a minute, but you go back and give back to those areas too. But I'm excited to talk about that. So, was there ever a time during this transition, you moved to this country, you had some family here, and so that was good. But was there ever a time between then and getting to medical school where you felt like giving up and maybe this just wasn't?
There's always challenges in life, right? There's always challenges. There was times where it was a struggle trying to adapt to the system, how you need to do things to get better. Giving up was never an option for me, just like my uncle said to himself. I've never thought about ever giving up, but there's always challenges where you have to rise to the challenge, rise to the occasion. My challenge was like, second year in college, organic chemistry, one of the hardest topics. I remember I went to Emory. Everybody came to Emory wanting to be doctors. After maybe the first quarter of that class, half of the class dropped.
It's funny how they start to call out, especially schools that focus on pre-med, right? They make those classes hard.
It was pretty, and unfortunately, our teacher at that time was not very good.
But I had a similar with general chemistry, second semester.
She wasn't very good, and I think she was just a little bit older. She just I think she had a different way to think about, generations change. You have to change your thinking about generation. So I decided to teach myself organic chemistry, and it really came out to be like that's when I learned that you can always do that stuff for yourself. So I told myself organic chemistry. By the time I ended this, I was setting the curve for everybody in that class.
Nice.
So that was one of the sort of the challenges I was talking about. I remember one time I was studying with him. He's still my close friend. He worked for Deloitte. He's in DC. We were studying because he wanted to be a doctor at that time. And we were just studying, and it was just so hard. He looked at me and was like, you know what? He just quit that day. I was like, I looked at him. I was like, wait. Like,
I'm out.
I'm done. He's like, I'm done. So he quit that day, but it was a very deep movement. I was like, wow. And he was all about being a doctor when we first started. That's how we became, because we had the similar class, especially like our first year. And I remember we were just studying, and it was just like, it was just so hard. He was like I'm gonna call it.
I had a few friends like that. Actually, I had a few that I wasn't really close to, but I can remember in chiropractic school. Chiropractic school is easier to get into, but the first 2 years they are parallel to medical school.
Of course.
I mean, you have a friend that's a chiropractor that you said was a good friend of yours. We literally, during exams and stuff, we would have people get up. I remember there's a guy in front of me that was an RN, and he got up and he just threw his test and Scantron toward the podium and this grabbed, and we never saw him again. And there were a few people that did similar stuff like that. They were just like, screw this. It's too much. It's too hard. So when did you first think about becoming a doctor and why neurosurgery?
Sure. So being a doctor was something, I don't know if my mom was trying to program me, but she was telling me like,
same.
You can be a doctor.
You're 5 and they're like, Dr. Sarpong?
Yeah, that's right. It was a program process. So that's always been in my head. And, I've always enjoyed doing the sciences, the biology and all that stuff. So went into school, that's what I wanted to do. I actually went into medical school, wanted to be a cardiologist. However, when I did sort of the medicine rotation, I realized that it wasn't hard, but it wasn't for me. You have to understand who you are. Yeah. Because in terms of medicine, you spend some time, there's a lot of time talking, kind of pontificating on matters. I'm a go person, Let's see patients, let's go and take care of them, and do stuff, So I felt like I would be a bad medicine doctor. So I switched my focus. So it was a heart of the brain for me in terms of the human system. CT surgery was kind of a sort of a dying field because like there's people not doing as much as they used to do before because stents and the cardiologists were doing all that stuff.
Yeah, so cardiothoracic surgery
was
I mean, there were fewer.
Yeah, fewer like, and it
Yeah.
felt like it had peaked because it peaked in the 80s when all these guys were doing some crazy stuff.
Yeah,
you know.
everybody was getting a
Yeah.
cabbage then, right?
Yeah.
And then they started interventional cardiology,
Yeah.
started fixing a lot of stuff, which
Yep.
is great
Yeah.
advancement.
Yep.
That recovers way easier.
Yes,
Yeah,
and it's less risky, right? So
unless they perforate.
yeah. I switched neurosurgery, and I love the field because it was so fresh, up and coming, no whole new ideas, and it made sense. And I just enjoyed the whole process. So that's when I switched my focus to neurosurgery.
And you really got in, and we've talked about this your first visit, you got into neurosurgery and probably started your residency and even in medical school when we were starting to learn more and more about the brain and nervous system than we had known. Like that, there was a decade there, like 90 to 2000 even, where we learned more in that 10 years than was ever known. And then I think that information keeps doubling practically.
I totally agree. And I think, I just looked at myself when I started residency in like 2008 to what we know right now. It's been so much, you know what I mean?
Yeah.
It's so much. And it keeps changing every day. So, it keeps you on your toe, it keeps you fresh. And the challenge is just stay ahead of the knowledge curve, kind of keeps you going, right?
Right. You have to. Information changes, the procedures change. And there's a saying that, I do consulting work and I will tell doctors, if you haven't changed the way you practiced in the last 5 years, if something hasn't changed, you're behind.
Yes.
I mean, there should be a shift.
Yes.
I mean, techniques, therapies, different interventions, because we're seeing such a rapid development. And AI now is going to we're going to see, I mean, it was exponential before. It's going crazy.
Yeah. So let me ask you like a little segue. So what do you think about the whole AI concept? Do you feel like, are you ever worried about it may replace the humankind? I mean, this is kind of going on off a tangent, but
So I think AI is a great tool, but I don't know, and it will probably evolve to the point where it's pretty close to human interaction and everything. But it's all programmed with algorithms based on current knowledge.
Okay.
And so, you can give it symptoms. AI right now could take a history and give you a differential diagnosis list.
Of course.
But it's the little nuances, as you know, in medicine, where it's that little decision-making process that wisdom is the only way I can say or call it, because after 30 years of practice, and even you have probably seen, you see something and you're like, yeah, there's something just a little bit off, and you can call it a gut feeling, you can call it God, you can call it whatever you want, but AI can't have that. And so that intelligence that it's not artificial intelligence, it's true intelligence, almost spiritual intelligence that connects us that I don't think AI will ever be able to have. So, there's studies out right now on how they're having AI overread radiology, MRIs and CTs, and it's finding a lot of things. But I still have comfort knowing that there's an educated radiologist there to double check it. So I think what it could do is make radiology much more efficient and overscan, and then but we're in trouble if we ever get to the point where the human sits back and just it does pretty good, it catches most things. I'm not concerned about the most things. I'm concerned about that 1% that's important for you. That's what I always tell people in our clinics where, and you probably get this too. People complain about the paperwork. They complain about the wait time. They complain about whatever. But, I don't know one person that when you find something seriously wrong, they're not grateful.
Yes.
And even in our clinic, when we find an aortic aneurysm or, blockage in the carotids and maybe it's an early signs of stroke or Parkinson's or something like that. When you find those things, then all of a sudden it could be the biggest complainer, but they're grateful that you were so thorough and that you took the time. It was a tangent, kind of a rabbit trail there, but
maybe that will be one of our talks next time.
But I'm a fan of AI.
Yeah.
I just, and I may change my mind over time, but to me, there's that little it factor, that intelligence factor that there's no replacement.
I totally agree
with artificial.
I totally agree.
Like I said, the only way I can explain it is that gut feeling, the intuition.
That's very true.
And I know that you've seen that in practice. So, let's talk about, in 360 Success, we talk about faith, we talk about family, talk about fitness and health, and we talk about finances. We're going to hit on a few of those today. But you met your wife. You guys met you were in medical school. She doesn't like say, she's like, I didn't go to the same college as you, so don't say that.
That's right.
But you were in grad school, medical school, and you guys met. How'd you meet?
So we met. So I was in Nashville going to Vanderbilt for medical school, and she was working for the local Fox affiliate down there.
Okay.
And
Is she a TV personality?
she used to be, but not anymore.
Okay.
Yeah, her name is Carlene Pry, wonderful, wonderful lady. So I went out with a friend of mine who was a nurse, and she was out with her friends, and I saw her, like, I thought she was the most beautiful girl I've ever met in my life,
She is beautiful.
She's,
The picture of her
yeah,
and your
no,
son
no,
in this magazine.
she's, I mean, I didn't think to me, she's the most wonderful woman I've ever met in my life. So I, she had all her friends right now. I was trying to get the courage to go up there and kind of.
Your friends are like, go, just go
Yeah,
talk to
yeah,
her.
I know. And we first made eye contact, and she just looked away. I saw she has no interest in me because I saw a lot of these guys trying to talk to her at the same
Playing
time.
hard to get.
Yeah, she was playing hard. That's what she tells me now. But I
didn't talk to me.
Yeah. So I finally had the courage to, like, maybe make a move and sit behind her, and as you see, she has a lot of hair. So she started rubbing on my shoulders, like trying to give me a hard time. And I was like, I'm sorry, do I know you?
Yeah.
That was my line.
You're in my space.
Yeah, she was like, no, I do not know you. You know you don't know me. Yeah, but that's how it started.
I like that.
Yeah.
Have we met?
Yeah, no, she was like, you know you don't know me. You just don't even start that loud. So, like, let's try this again.
So where were you in medical school? State?
I was
year?
I was the second year.
Second year.
Yeah, so we met and we've been together since that time. And she's been, like, a lot of my success in life has been with her,
That was my next question is how did that relationship contribute to your growth and current success?
Sure. I think a couple of things. One, in terms of how she, unfortunately, a lot of doctors, we tend to have this arrogance that we all have, a lot of arrogance. We think we're smart. We think we're better than a lot of things that we think we are. But having her in my life, she made me more human, more humble, and she pushed me
Kept
to
you grounded and anchored.
Yes, very important. Yeah. And she pushed me to, like, be more open, be more welcoming, be more, like, speak from your heart, what I mean? And that's helped me a lot. It just kind of, like you said, when you see me, like, I'm that person, but I used to be very close up. I didn't want to share that with people, but she just wanted to push me, like, you have to be open. You have to talk to people. Because when people get to know you, they will love you. You know what I mean?
Yeah.
And
I loved you. I hugged you the first time I met you. When you were leaving, we sat here visiting.
Yeah. So, but she's been great. And, and whenever I've had setback, and, medicine is harsh. There's been good times. There's always bad times, And whenever I've had, she's like one of the best time I've had. It's like, I remember through residency, I was kind of getting a hard time. There were certain people that were doubting my ability to finish the program, and she pulled me to the side.
Like your chief resident.
Yeah. It's like she pulled me to, like, honey, show them who you are. That changed everything for me that day. I was like, oh, okay. Yeah. So let's go to work.
Show them the man I know you are.
Yeah. So, and it was one of the best.
I'll tell you what, I'm married to a woman like that too. I'm gonna start crying again, but she saw the potential in me before the success was there. Yeah. And so, now, I mean, I know that the hours, neurosurgeons still have to take call because they don't have a hospitalist neurosurgeon, and so the hours can be grueling sometimes. What do you do to intentionally balance that work and life? Not that that's, I call it work-life integration. Yeah. And it may be FaceTiming with the kid because you're on call and you have to be at the hospital, maybe. But so how do you do that to be intentional in that?
We do that a lot. A lot of FaceTime. Whenever I have any minute, like, especially when I'm on call, whenever I have any minute, I'm going to FaceTime with my wife and my kid. You know what I mean? Yeah. And, I try to get everything done. So when I go home, it's wife and kid time, and that's very important. That's one of the best things. Like,
that's why it takes you so long to answer my text.
That's right. But yeah, that is, to me, that's the most important. I love my son. He's one of the best thing I ever had in my life. And my wife, she makes my son better. So it's like, whatever I can do for them to have a very peaceful, wonderful life, it's my focus in life. You know what I mean?
That being an immigrant and growing up poor, but having a desire to help people was your why early in life. And that's still part of the why. But isn't it amazing how your heart changes and evolves? And it's like you grow a second heart for family. You have this passion for your profession and what you're doing, but you have this heart for your family. And, I've heard it said, I was worried about having more than one child or adopting like we have and stuff. I'm like, I don't know if I can love another one like I love this one. Yeah. But it's like God gives you a heart for each thing.
I know, isn't it? It's beautiful.
It is so beautiful and so amazing.
It's beautiful. It's beautiful.
So if you could go back to that 12-year-old and you were pretty inspired, it seems like early age, family inspired you and stuff. But if you go back and you could say one thing to 12-year-old little Yaw, what would you tell him?
I would say perseverance is the key to life. I would say always be humble, always remember your goals, always believe in what you believe in, which is God. And
Yeah.
he's gonna guide you where you are right now. So be who you are, you know. And one of the most important things though that I thank my mom for ever telling me this, never forget where you came from. Which has been very helpful, you know.
That's true.
Sorry.
No, that is,
Yeah.
I don't know if you had a chance to listen to the other podcast, but me
Yeah.
talking about how my grandparents were sharecroppers. My dad was born at home, and he never let me get too big for my britches, is what he would say. He's like, you didn't come from that.
Yeah.
And he made me work hard.
Yeah.
But, people are struggling right now. And, I think it's mostly political, but, I have a black son that I raised. And so, but I do know that there's still some racial division. I think a lot of it is instigated. It seems like they want division among us. But if you could tell a young immigrant or a young black man or, really any, what we consider minority, I even hate that term. Let's just put it this way. If you could tell a young man that's struggling with confidence or whatever, what would your advice be? Because like I said, you're at the pinnacle of success in medicine. You've gone from the low of low to the top. What would be your words?
I do a lot of mentoring for young people, and I always, especially when they feel like they're in a position where they're kind of struggling, I always tell them, you're beautiful. You are something special,
Yeah.
I know like society may not let you see that, but you got to believe in yourself.
Yeah.
Believe in yourself. You can do whatever you set your mind to. That's what I always tell anybody.
My dad used to tell me that.
Yeah.
So my dad would take me to school, starting in 5th grade till I started to drive on his way to work. And he would look at me, and it was either at breakfast or in the car, and he would say, "Son, I just want you to remember today that you can do anything you set your mind to."
Yes, that's very important.
Yeah. I went to a small private school, and I haven't even asked them, but I'm pretty sure I was probably on scholarship there. But he would always say that, and he would say, when I'd get out of the car, he's like, "Have a good day, Dr. Knight." And this is in 5th grade. Because he grew up so poor that he wanted me to make sure that you always want your kids to have better, not just have better, but do better and leave a legacy.
And also going back to what that uncle that I mentioned earlier. So I remember one time it came, same through the residency problem, was going through the problem. And he was like, he and I were talking. He was like, if you set your mind to something, you can always do it. Just believe in that. It's very important. Yeah.
I tell people, and early on in practice, 5 years in, I was bankrupt and failing, but there's always been this, that I just will not quit.
Yes.
When like teenage boys get in a tussle or a fight or something like that, and if somebody started mouthing off to me, I would say, "Look, if this goes down, you better knock me out because I will never stop."
I'll make you cover.
Yeah. I've always just had that. There's no quit in me. Once I start down a path, I will see it to the end. And you have to have that tenacity. And I think some of that's missing.
Yeah.
And I think it's missing because there's not the role models that you and I have had.
Yeah.
But the fact that you're mentoring young men is fantastic. Speaking of mentoring and kind of giving back, I don't want to close this out without talking about the nonprofit that you and your partners do.
So let me kind of talk a little bit about our programs. Group is called North Texas Brain and Spine. We are kind of based in McKinney right now. We're looking at to expand.
Your website is
ntbss.com.
And I'll put that in the show notes.
It's myself, Dr. Benet, and Dr. Apia. We treat brain and spine. Those cutting is the last thing that we do. We like to always be do everything else before we even get to that level. And if we have to do this minimally invasive, because we want people out of the hospital, home, and feeling better.
They recover better at home.
Yeah. People recover better at home. And so that's that. We treat pain, we treat spinal disease, we treat brain disease, we treat all the whole lot. But the thing is, the one thing that's unique about us is, we all have African backgrounds. Dr. Benet is from Cameroon, Dr. Appiah's from Ghana, actually. And we form a group called the Brain Project. And basically our goal is to kind of bring neurosurgery to all these underserved areas, especially in Africa. We will go, normally what we'll go is we have relationship with different hospitals and different groups in different countries. And, we'll say, hey, we'll be coming in July. Please, let's have, collect all the patients you feel like need something done, and just kind of so we can take care of them. So we'll have, like, we'll spend a month, and we'll probably do like, almost 30 or 100 cases in a month, depending on how many people that we have. And we'll bring, instrumentations, we'll bring,
So does one of you stay here when you're doing that, or do you
yeah,
alternate?
we have to alternate because
Can't close your practice.
Can't close practice. We have to alternate, but it's always been wonderful because I think I showed you some of the pictures of the people with massive brain tumors.
That baseball size right in the middle.
Yeah. So, and we do it at the luckily we have a lot of other friends who have African background who are interested in doing that. So we will usually have conferences, and we have non-African people that come to. We have like some really good white friends. Like anybody that wants to join,
you've invited me to come along.
Yeah. So, and everybody's been, we'll have conference where we talk about how do we want to do this case. We folks most comfortable handling this case. So we go. Everybody has their role, and we get going. We just take care of patients, and we've had some really good success taking care of patients. People that couldn't walk are now walking. People who have massive brain-sized tumors doing great well. So it's been a very, very pleasurable experience, and we always want to encourage and bring more people, donations, whatever we can, because like a lot of the like instrument groups will kind of give us stuff that we can take. A lot of the companies will give us stuff that we can take with us so we can help people, and we leave it behind so people can use it. So
well, that's fantastic. Yeah. I like to say that we're funnels. God blesses us with things and with money, and those are tools to be able to help and serve. And you and I were talking about the title doctor. That just means teacher, and that knowledge, to me, the gift of knowledge, just makes you more accountable in service. And so the fact that you guys do that, I love it. When we have surgical patients, you're going to be getting them from us, I guarantee you, because
I will love to help take care of patients.
And, the conservative approach, surgery last, let's try all these other things. That's, we're not anti-surgery at all, but we know that there are so many things to do before that. Yeah. But I know from having had, I think I was telling you about my herniated disc and how horrendous of pain I was in. Yeah. And I understand why people want to go to surgery so quickly if they think it'll give them relief. But there is a path. And like you said, do everything you can. You get cut. And I told you, I consulted with a friend of mine who's a neurosurgeon. And he's like, if we get you on the table, here's what we're going to do. And I'm like, we're not doing that. He goes, I don't want to do that. So don't get on, do everything you can first.
One of my mentors, like in neurosurgery, once told me, like, you can always do surgery, but you can undo surgery. And that's my mantra.
Cannot undo it. That's right.
So I was so patient, before we get to that, right, let's try something else, because if that's the case, we'll get to it. But if not, we don't need to get to it. You know what I mean? Yeah. So, yeah.
Well, man, I appreciate you being here today.
Thank you so much.
You're a blessing to the community. Yeah. And we look forward to working together. And, I love your story. When we first talked, I'm like, you've got to come on the podcast. People have to hear this. And hopefully your patients hear it too, because I think them seeing the human side of their doctor, because we don't always have time for them to get to know us. Maybe they can read in a magazine in the waiting room or something like that. But we do have passion in what we're doing and for our families and for serving people. So I just really appreciate you. And I look forward to getting together with you and your wife and meeting your son. Your son's Kenzu?
Kenzu, Kenzu Sarpong, yeah.
Beautiful. And you guys have plans for any more Kenzus?
That's the hope. That's the hope, right? One or two would make me happy.
All right. Yeah. Well, thanks again, brother. We really appreciate it.
Thank you so much. Thanks for having me.
Absolutely.
Really pleasure.